Good morning, folks. My name is Robert Henderson. I'm a doctor of physical therapy here at Austin Physical Therapy Specialist off North Lamar. Wanted to take just a brief moment today to talk about one of the modalities that we choose to do here if needed for our patients. It's called dry needling. I think it's important to really differentiate what dry needling is in comparison to acupuncture. I want to take just a quick moment. Acupuncture is really based in Eastern philosophy, Chinese type medicine. They really use a meridian platform, whereas they'll put a needle in an area that helps refer to another area for pain relief. Whereas with dry needling, I'm going to go directly into the area where you may have pain to help relieve some of those symptoms. We do have wet needling as well, where we administer a needle into a solution to help with pain relief, but this is going to be dry needling, so no medication or anything would be administered into the body. Some of the things I wrote down that I felt we often do. We do a lot of treatment for all the back, all the hips, the knees, patellofemoral pain syndrome, neck pain. It helps a lot with headaches, tension headaches that could maybe result in migraines down the road. Tendinitis, especially sciatica in the lower part of the body. Those are just some of the things that we do a lot of dry needling here at our facility. You know, the physiology behind dry needling, just real quick, is it does create more blood flow. It's one of the few modalities that we can use to help get really deep into the body, depending on the depth of the needle. And it encourages blood flow. It causes a lesion that the body responds by wanting to help close that hole up, and that encourages a lot of really good blood flow into the body to help the restoration of those tissues. So that's kind of the philosophy behind dry needling. I'm going to show you just a quick, real quick, couple spaces here on Ashley's neck that we can really help. She's certainly having some headaches. We're just going to show you a little bit of how dry needling works. So come on this way here. Let's see. Let's do. We would never do anything without patient's permission. This is something that we really try to not do unless it's necessary, unless we find that, you know, other types of modalities, you know, for example, a lot of hands-on therapy. A lot of us here are really skilled with manual therapy techniques. So if those are going to work for a patient, we're always going to give those a shot prior to any time putting a needle in a patient's body. But I think that most patients have always found that dry needling is very, very helpful, you know, for pain and limited range of motion and, you know, acute and chronic pain. So that's just a demonstration real quickly of how it went into Ashley's cervical area for releasing some of that tension. You know, if I were to do a complete demonstration, I would go ahead and just apply needles all the way down Ashley's cervical paraspinals here, and then I want to show you one of the techniques I'll do on the upper traps as well. A lot of our folks have really tight muscles on those upper neck muscles, and this really helps. There's a couple different techniques. I use each technique just kind of depending on the patient. One of the big things here is making sure that we're really cautious and cognizant of our lungs here, so we want to be careful not to puncture anything with the lungs. And I like to use a pistoning techniques. I will actually find those trigger points. Those trigger points are those really sensitive, tender points in the body that often need to be worked out. A lot of times our hands-on techniques will do the job, but occasionally they're so chronic that a little bit more of a different option is needed. So that's where dry needling comes into play. So that's a little bit about dry needling. I'd usually leave this in here approximately 5 to 10 minutes. I've worked with Ashley quite a bit. I'm very comfortable leaving the needles in there. I'm very comfortable doing more than one needle at a time. In the event it was your first time, we would definitely get a feel for one another. We would make sure that you're comfortable, not going to pass out on me, anything like that if you're fear of needles, and just kind of get a customized plan that works for you. And most patients see you know, good response usually within 4 to 6 sessions. Some sooner, some later, and sometimes it's not a good fit, and that's okay, but this is just another option for our tool bag. So I hope you enjoyed what you saw today. Come see us if you need us. Thank you very much.